is because we talked about legal issues, I have the dream of the accused, and I have a case of intuition. Now, if I may I hand you this book? I'll take the envelope back because we won't use it. I'm going to ask you please to tell us how many pages are in that book.
199.
199, if you allow me the poetic license to say 200 pages, in a standard galley proof of a softback book in the United States. There are approximately 100 to 150 letters per page, 200 pages. It's about 30,000 words in there. Now what I'm going to do is I'm going to ask, if I may, Dr. Whitcoff-Morey, from 1 to 199, what page would you like?
167.
167. I'm going to ask you please to turn to pages 166 and 167, and since we read from left to right, that would put you on page 166. Is that right? And I'm going to ask you silently to look at the first line at the top of that page, and I'm going to have you look for the biggest word, the longest word, the most letters, the most syllables, and once you've found it, I want the two of you to commit that word to memory, and then close the book. Perfect. Yes. And I'm going to ask for you just to say stop at any time.
Stop.
Very good. Are you satisfied with the word at the top of the page? I cannot see it.
Yep.
You've got it? Okay, very good.
Mm-hmm.
Okay, satisfied?
Yes.
Not on the other page. I'm
Okay.
not looking at that. Okay, very good. And now if I may I hand you the book, and I'm going to ask you please just to leaf through there to any page you want. Silently to any page. Once you find the page that you want, I'm going to ask you silently to scan down that page for a word. For today's purposes, the biggest word, the longest word, the most letters, the most syllables, it will make this the most impressive. And once you've found it, and if you're not happy, you can go to another page. If you got your word. Very good. I'll take the book back. Thank you. I'm going to ask for you, please. I don't want you to tell us your word, but I'm going to ask you, if you will, please, to just share with us all the first letter of your word.
E.
E. The letter E in and of itself tells us nothing. However, this is what we do as physicians. First time we see a patient, we get a letter. It goes into the chart, metaphorically, a letter E. Then we may, the next time we see them, get another letter, maybe a Y. And then the next time they come, we may get another E. And then maybe a G. Now the unconscious mind goes to a word that has meaning. Out of the 50,000 words in this book, you selected one word that reminds us. When patients come to us, we need to help them see clearly their diagnosis and treatment approach. Because the word you're thinking of is E-Y-E-G-L-A-S-S-E-S. Is that correct? Eyeglasses.
Yes.
Thank you. And you silently selected a word that again has meaning, that reminds us as physicians, when we engage in treating patients, we want to do so firmly, with an appropriate direction of scientific knowledge, because you're thinking of the word D-E-L-I-B-E-R-A-T deliberately. Is that correct?
Correct.
Thank you all very much. We'll see you all at dinner.